Dr. Tshepo Maaka and Kabelo Maaka, thank you so much for joining us today.
Thank
Thank
you.
you for having us.
So you are a team of mother and daughter, and together you have created a documentary called Three Teaspoons of Sugar. What prompted you to get to the documentary? What the background story to this? And I'm going to start with the mother, Dr. Tshepo.
Look, I had no intentions of ever being in animation at all, but I realized that it is a good tool to simplify complex medical things. I trained in anesthesiology, and so when I first had my challenge in explaining what an anesthetist does, I realized that animation could actually help me. And when she did that, I then said, okay, let us collaborate and work together and create medical animation and content. That was the first thing.
Do you remember when you were first diagnosed with diabetes?
It was in 1989 when I lost my first baby. I was diagnosed with sugar diabetes. It was pregnancy-induced, in fact.
Kabelo, why did you get drawn into this project?
So I have always loved animation. As I have kind of been doing animation in South Africa, I decided, you know what, let me just start my own company called Kabelo Studios. And Dr. T, who's my mom, came in and partnered with me. And then that's how I realized, okay, we can create animation in the medical space. And then specifically for this film, it was kind of a natural thing to tell the story with our family because the animation also features the actual voices of our family members.
So it's really drawing from personal experience. And Dr. T, as you like to be called, talk to us about the issue of diabetes. We know that it is a growing problem in developing countries, and Africa is seeing its share of the burden.
In South Africa right now, we're sitting with just under 5 million cases of adults with diabetes. So it is quite costly in terms of the burden on families, on quality of life for those that have diabetes, but more importantly, on the health systems. So it's something that we cannot ignore. It's something that we cannot just sweep under the rug. It is one of and currently now, people that have diabetes are at high risk of getting complicated COVID-19 and even dying from it.
Kabelo, can you talk to us about creating animation around this story? Usually when we think about animation, a lot of time people think that it's for children. So how much impact do you hope to create using animation to raise awareness about a problem that is affecting many, many adults?
What I think is really lovely about animation is that it can make medical content charming and actually less intimidating to engage with. So with our animation, we're really hoping to make the information easy to digest and easy to remember, and also make it personal.
And what I like, just to add on that, is that health literacy is very low. Animation allows us to talk to people at all health literacy levels. And also because you can dub it in different languages.
Yeah.
What do viewers take away after they watch this short film?
So a lot of people have said, they've connected with the story because their families have gone through similar things. Others have said, oh, you guys made it so easy to understand and see the symptoms because you explained them so simply with the drawings. So my intention was just to try to share a family story and try to be as clear as possible.
So, Dr. T, how do they make sure they don't get it? And if they get it, they don't get the complication?
We have a history of diabetes in our family. So for us, exercise is on top of the list. Secondly, it is eat small portions, make sure that you have a balanced diet, more fruits, more vegetables, avoid processed foods, avoid fizzy drinks, drink a lot of water. Obesity is a risk to developing diabetes. So you have to make sure that your weight is contained, and if you have a diabetes, ensure that you get checked by your physician to make sure that your eyesight is okay. They check your heart. They will check your kidneys every now and then and your sugar level. And make sure that you're compliant with your medication.
So Dr. Tshepo Maaka and Kabelo Maaka, thank you so much for joining us today.
Thank you for
very
having
much.
us. Thank you.